So I'm Dr. Dale Brown. I'm the Wild Doc. Going to give you a little bit of a mindset shift and adjustment here today. No pun intended, considering I'm a chiropractor. I love what I do. Help a lot of ladies with infertility. My wife, in fact, was told that she would never be able to have children, and voila, we have 3 children. You know, good at what I do. Anyways, come on now. That's funny for some, I guess. But here's the reality. We're going to be talking about infertility, autoimmunity, and developmental health risks in children, especially born to women who conceive artificially, who have to undergo artificial reproductive technologies. That's referred to in the research science. But again, in vitro fertilization is one mechanism in which they do that. So we're going to talk a little bit about that, and I want to get this information out there to as many women as we can that are dealing with infertility, specifically because of the health consequences and risks of that process. Now, healthy children have been born through that process, so there are times in which there would be a need. There could be a structural abnormality, the fallopian tubes, different things like that. But in the situation such as autoimmunity, or in this case, I'm going to be talking to you about autoimmunity and a condition known as pernicious anemia, which leads to vitamin B12 deficiency, folate deficiency. And that there can cause massive health consequences, both for the mother, but more specifically for the developing fetus, especially the developing fetus's nervous system. So we need to come about our healthcare approaches with the proper mindset. And the mindset needs to be, why is this not occurring if we're talking about fertility? Why is pregnancy not occurring? Why specifically? That question is often not asked in a fertility clinic. Yes, they did not ask the proper questions. She had been to fertility clinics after the patient I'm going to be giving an example of, looking at her lab work with you, because of the findings that we found. And I had to have the sit-down conversation with her and let her realize and help her realize. And I think it helped her quite significantly with that mental strain and mental stress of losing another child, which happened recently. All right? But I had to sit down and talk with her and say to her that the reality is, I believe God said, you know what? I don't want that child to suffer. So I'm going to bring him to me. Because of the underlying factors that are leading to the infertility in this situation, that could lead to the neurodevelopmental health problems and consequences in her child, even if they're born. Even if the body was able to carry that artificial, if she would undergo artificial reproductive technology practices and be impregnated artificially, and then just given hormones to force the body to sustain the pregnancy throughout the entire 36 maybe, you know, preterm labor occurs a lot in artificial reproductive therapies. All right? So I think that helped calm her mind down, because what we found is what we want to take care of to enable the body to be able to accept a pregnancy and carry out a full-term healthy pregnancy, because think about the consequences here. Mother and father dealing with infertility issues for years upon years, not understanding quite why, so they seek treatment through a facility advertising and touting themselves as, you know, the specialists in fertility, a fertility clinic. And they undergo the standard treatment, which is, we'll test your follicular stimulating hormone, we'll test your progesterone levels, and then, you know what? We'll do artificial insemination. And we'll hope that sticks, and then we'll bombard your body with these hormones, these synthetic hormones, to try and keep that pregnancy throughout. And what if the parents, they decide to undergo that type of treatment and it's successful? How do you decide or define success, though? The reality is, I believe that every parent would say a successful pregnancy would be one that brings a healthy child into this world. Now, every child is a gift from God. Every child should and deserves love, no matter what issue they may be born with, all right? Whether it be autism or incomplete development of their central nervous system, spinal cord developments, cleft palate, cleft lip, it doesn't matter. They're all beautiful children. They all deserve to be loved. But think about the strain and the stress on mother and father when they find out that their child is going to have severe brain damage or incomplete development of their spinal cord and spine. They come to find out that their child now has brain damage and has all the symptoms that they label autism. And then later they find out it was because of an underlying factor that some simple tests could have figured out why the mother was infertile in the first place, and if that underlying factor was taken care of properly, then the mother could have become pregnant naturally, and the mother's body, with that problem and that deficiency corrected, the baby's nervous system could have developed normally, and they wouldn't have to care for now a mentally handicapped or mentally disabled child. It could break somebody's heart, so I hope people pay attention to this, because we need to figure out why, not just force it upon the body. It's a critical mindset shift we need to have in the entire world, in fact. Again, I'm saying and repeating myself, every child that's ever been born under that manner is a gift from God, and I hope that every mom and dad don't take this the wrong way and say that that was the wrong thing for them to do, because there's a lot of healthy children that are born in that manner, and I thank God for that. And I'm glad that parents were able to find and be given the gift of childbearing. But I want to help more women. Well, I want to help less women have to deal with the strain and stress of caring for a child that is born with a developmental health problem. So we'll be talking about that. So I appreciate everybody being on. I'm excited for this talk and going through some of these research studies. People like Rona are on. Ashley, appreciate. Amy, hey, what's up? People had no sound at first, but we got sound now. Love of love, the wellness way, Amy says. Thank you. Yes, the wellness way is exactly what we do. It's the proper thought processes and testing that lead to the ability to help people. B12 deficiency is huge. Never take cyanocobalamin. Pro-life here too, Patty says. Absolutely tuning in from Camp, Arizona. Nice. Appreciate you being on there. Evan Marie. All right, so here we go. So the association between assisted reproductive technology and the risk of autism spectrum disorders in the offspring. So this would be in the offspring, so in the child of the mother who undergoes, or even in the father too, they find it in male and female, they see an increased risk of autism spectrum disorder and developmental problems. They've already shown, before this study that was published in 2017, they'd already shown that it has been reported that the use of artificial ART, and that quote you see in the screen in front of you, and that ART means artificial reproductive technology, okay, or therapy, increase the total risk of congenital malformations, so in essence, like simplified to birth defects, by about 1/3. 1/3 the increased risk, with approximately a twofold increased risk of central nervous system defects. And your central nervous system, folks, runs and controls every single physiological system in your body, from your heart rate, your respiration, your digestive tract. Every single thing in your body is controlled by your central nervous system. So realize how important that is to have a child born with a healthy nervous system without defect. The cumulative evidence has suggested that the use of reproductive technology, artificial reproductive technology, may lead to an increased risk of birth defects, preterm delivery, low birth weight, genetic imprinting disorders. So genetic disorders because of the use of that technology, or rather to the underlying health risks and health problems that lead to the infertility in the person in the first place. It is the condition, oftentimes, for many women, is the underlying condition that is leading to the infertility. And if you treat the patient properly, not just given a blanket artificial forced insemination process or impregnation process, you can actually help the body accept a pregnancy if the mother becomes healthy enough. There are many health conditions underlying that result in infertility problems. Ashley, can you get on me a little bit too?
You're on.
Am I? I see. Am I frozen? Okay, gotcha. Frozen. I'm like, wait a minute.
I leave it up
Sweet.
a little bit so they can read it, follow along, and I switch.
Gotcha. Sweet. So back to this. I'm still trying to get used to this technology stuff. Figure out whether, because of my delay on the Facebook here. So anyways, if we help the women get healthier, if we help somebody get healthy, we identify the underlying causes, then we can allow the body to be in a state in which it can accept the pregnancy. If you look at animals, especially like in captivity, you'll see that, for a very long time, it was difficult for pandas to have babies. And the first panda ever born in captivity, and all of these different animals, they have to create the zoo and their environment as healthy and as natural as possible, because the female body under stress goes into a situation, into a response, especially immunologically speaking, into a state in which it can reject a pregnancy, and that is a survival mechanism. It is a mechanism ingrained in our physiology innately so that mother can survive and also reduce the risk of bringing a child that could be stricken with a severe health issue. So if we understand that, we want to get to the root causes, and that's the whole goal here in the Wellness Way. Pernicious anemia, again, just kind of describing this through vitamin B deficiency. It's a nutrient found in some foods. It's more in animal product foods. It's generated through bacteria in the gut. If you have a healthy gut microbiome, if you have a healthy gut as well, you typically are not going to. It's not a very prevalent. This specific anemia is typically, it's not a prevalent issue. It's very rare, they consider it, in women of childbearing ages, but when it is present, it's a significant cause of infertility. Just note that. But pernicious anemia, they say, though rarely encountered in women of childbearing age, untreated pernicious anemia has been found to be a cause of infertility. Once treated, conception often occurs within months. The case presented here of treating B12 deficiency. This individual had skin disorder as well, and we're going to touch on that a little bit because that was something also, but it wasn't vitiligo. It was actually the patients that I'm seeing actually saw increased autoimmune responses to their skin, scleroderma. So had an autoimmunity against their skin. And that's another concept that we need to understand. Again, if autoimmunity can cause infertility, but autoimmunity could actually cause developmental problems. Even depression in adulthood is more prevalent in children born to mothers dealing with an autoimmune condition, and with the significant elevated rates of autoimmunity being seen because of factors that we will not discuss here in this video at this time, but they're autoimmune causes that we're seeing cause an elevated number of women of childbearing age to be stricken with things like lupus, rheumatoid arthritis, Hashimoto's diseases. All right, so if we were to, those diseases, if we were to take the understanding and say, there are triggers, there are immunological and even neurological triggers, and research study I always like to state or give you a title of, and it's not in the comments. If you comment right now or in the resources today, but if you comment in the comments on Facebook, Facebook alone will not work on YouTube. Just want to always point that out. Doesn't work on Instagram either. But if you go to thewilddoc.com, you look up the title of this video, you'll find the references and research articles that I'm using here today. But one is, sudden traumatic spinal injuries can induce and cause autoimmune conditions, traumas to the spine. They see that neurological imbalances, specifically the usual response in the nervous system or imbalance, is seen as a low parasympathetic nervous system regulation or low parasympathetic tone. What that does then is it doesn't allow the body to use the parasympathetic system to calm down our immune response. And medicine knows this. There's in fact research right now taking place into trying to develop what's called electroceuticals or electrical devices that they'll hook up to the nerves of your body. And specifically, they're using vagal nerve stimulation or vagal nerve stimulation. They use an electrical device low. It's not like shock treatment. It's not like you're putting a taser to your neck. Don't do that. But they're using like a low volt taser in essence. That's in essence what they're doing. And they're putting up it roughly around the jugular vein, and they're giving a low electrical current, and that stimulates, because this is where the vagus nerve travels in the neck. So they're doing electrical stimulation to the vagus nerve, and they're actually seeing reductions in inflammation in people who are dealing with autoimmune conditions. They're talking about how they can hack into the nervous system now using such devices. And this is where they say medicine is starting to go, into harnessing the power of the nervous system to be able to control or upregulate or downregulate different systems of your body to allow your body to function properly and heal. As a chiropractor, I'd ask the question, why do we need an external device to stimulate or upregulate or even downregulate what our body should be doing on its own, which is, again, through our central nervous system. One of the factors is sudden traumatic spinal injuries can induce autoimmune conditions, meaning traumas to our spine can actually disrupt the normal balance of our central nervous system, leading to the diseases of rheumatoid arthritis, lupus, and others, typically with other underlying factors in place as well already. So it can be the straw that breaks the camel's back, typically not the only cause, but it can substantially improve the quality of life. Hey, go grab 50 and Finally Free and then see if we can link to that if we got it written in text on the website, 50 and Finally Free. I'll read you a testimony when we get done in here of an autoimmune patient that had infertility, sadly didn't make it to my office until she was 50 years old, which thank God even at that age, she was able to come off of every single one of her medications, and no other doctor found the causes of her problems. And the primary thing we did with her, we did spinal correction and allowing her nervous system to upregulate and balance out. She was able to overcome rheumatoid arthritis and lupus and a lot of other things. All right, kind of refocusing back on this case, effects of B12 deficiency or folate deficiency on the brain and development of children or in children. So folate deficiency is in the preconceptional period, contributes to neural tube defects, deficits in B12, have negative consequences in developing brain during infancy, and deficits of both vitamins are associated with a greater risk of depression during adulthood. So there's a lot of things that are associated, specifically central nervous system problems. So here's the lab test results. We did an autoimmune panel on this patient because she'd have autoimmune responses and scleroderma, basically inflammation of her skin. So we knew she had some sort of autoimmune condition. Another factor in the obvious situation was she had post-implant autoimmune symptoms. Ladies, breast implants can lead to, it is a foreign object in your body. It can literally mold. It can leak. You may not be fully allergic before they put it into your body, but then you can become allergic to those implants. I'm just sharing personally, this is why once my wife is done breastfeeding, you know what? We're gonna go and have explant. Before we were ever married, before we even met each other, she had implants. All right, so we are going to go through the process to allow my wife to be much healthier. All right, and men, do not balk if your wife asks you if you'll stand with her to have her implants removed. Do not be selfish, because implants can destroy the lives of women. All right. So a couple different markers you'll see on there. Again, significant for her was like the scleroderma, which can go up and down. Even though it's negative, most things were low enough to be considered negative, though she did have slight autoimmunity towards ribonucleoproteins. She had scleroderma antibodies. So she had these antibodies. Two big ones we found was actually antibodies against gliadin. So she cannot have any wheat whatsoever, period. So we know that for a fact. She had already, even before this test, had already been on a completely gluten-free diet, completely grain-free diet. This individual is actually, like, I almost consider her as a fitness model. She is very, very physically fit. She trains other people. So she does a lot of things right with her health. She eats really good, which is honestly probably what is keeping her body from going like hardcore autoimmunity and her being stricken with like major chronic fatigue and full on can't overcome the illness and disease. So she's doing a lot of things healthy for her, but she didn't quite know why everything was taking place. So this autoimmune panel really was able to detail out what her specific issue is and where we needed to target to start to figure out how we're able to heal her body. And that is the wellness way. The wellness way is to figure out why you're dealing with the issues that you're dealing with, not just ask you what's going on and then grab some supplement or herb or, like a medical approach, which is grab some drug off the shelf to treat your symptoms. Either way, wrong idea. The right idea is we don't test, we guess, or we don't guess, we test. I'm dyslexic at times. But what we do is we figure out why. We ask the question why. You should always ask me, why is this going on? And at times I'll know the answer, and at times I don't. I'm an everyday, ongoing learner. This is what enables me to help so many of my patients, because I'm not satisfied ever unless I've got literally a research study pulled up on my laptop, reading and educating and learning, because my patients that walk through my door, they deserve it. And what I'll say is I can speak for the vast majority. I believe the Wellness Way docs are some of the best in the world to be able to help people deal with such issues as this. We have the tools, and then we have the know-how and knowledge, and we have a group of doctors helping each other become more and more aware and more educated to help people deal with this stuff. Again, the whole issue here was this woman was dealing with an autoimmune condition. She had autoantibodies against gastric parietal cells. So her intestinal wall was being attacked. Her intestines were being attacked by her own immune system. If you look up autoimmune gastric parietal cells, or antibodies against gastric parietal cells, you will find very, very quickly that it leads to pernicious anemia because there's inflammation of the digestive tract. Now, it doesn't have to be all the time just a full-on autoimmune condition that is going to do this. You could have other reasons your digestive tract is inflamed. You could, in fact, be vitamin B12 deficient if you're a vegan. There's an increased risk of developmental problems in straight 100% vegetarian, don't eat any animal products. You need to be supplementing if you're going to eat that way, all right? I don't agree with a completely diet filled with no animal products whatsoever, all right? Because I wouldn't feel you would have to supplement, or you could become deficient if the food gave you all you needed. We should never have to supplement if our diet was right and there was no underlying immunological, neurological mechanism that was causing the inability to absorb the nutrients that you're consuming, all right? My goal with this patient isn't to just give her a supplement. I could say, oh, look, you have pernicious anemia. You have gastric parietal cell antibodies. Thus, pernicious anemia is what we have. That causes infertility. Here's a vitamin B12 supplement. And go back, and you and your husband go ahead and have a child. I had a very important critical discussion with this patient saying, I do not want you. I actually want you to use the timing method or any other protection except for drugs that is necessary not to get pregnant over the next 3 months. Now, if you read the peer-reviewed literature, you'll find plenty of cases within a month or two after taking a B12 supplement that women got pregnant. But what I want to do is take the time of these 3 months with this patient to be able to say, let's get your immune system under control. Let's lower your inflammation, because your heightened immune system could actually be another factor, not just deficiency of B12, that could cause inability for the central nervous system to develop properly, but inflammation driven through the immune system is known to also cause an increased risk of developmental health issues in our children. So we want to take care of both aspects of this, all right? And taking care of the underlying cause would take care of the deficiency, allowing us not even to really need to be supplemented. We may do it for a safeguard, and that's the good thing about supplements, is they're a guardrail. They assist in us staying on track to be able to provide health. Do I feel they're absolutely critical and necessary? No, I do not. Like with our pregnancies with my wife, we didn't really supplement hardcore. We had it there, but I don't think she finished a single prenatal supplement. Am I advising this? No. No, I'm not, because I don't know your situation. But what I'm saying is we were designed, if doing the right things, we could actually bring healthy children into this world with no assistance other than living a healthy lifestyle, as long as, again, you must realize why I'm emphasizing this, as long as there is no immunological and neurological factor that would lead to the inability to absorb and utilize the nutrients you consume. So, pernicious anemia, new insights from the gastroenterological point of view, so the digestive point of view. So not just the immune system point of view, but the intestinal point of view. Here it is, long-standing gut bacteria infection, Helicobacter pylori. Infection probably plays a role in many patients with pernicious anemia, again, in whom the active infection process has been gradually replaced by an autoimmune disease that terminates in burnout, infection, and the irreversible destruction of gastric body mucosa. No, it's not irreversible. I disagree with that. Again, this is a medical research paper because I've seen massive intestinal and gut problems reversed with the right protocol and process, all right? But this is a strong statement and a strong understanding. We can give you a strong understanding here. Think about this, folks. What causes immune system problems? What causes, autoimmunity? Autoimmunity can be neurologically rooted, or it could be immunologically, or, of course, right? Everybody's like, of course, it's autoimmune. But why is it on autopilot? Why is it being triggered and not calming down? The nervous system calms it down, but if the nervous system is even healthy and can function properly and communicate properly, if you have an infection, like they're saying here, you are going to have a constant trigger of your immune system, and you're going to eventually go into autoimmunity. Not necessarily 100%, but the vast majority. Does this make sense to everybody? And I hope it does. You know, I love the thumbs up and stuff when it makes sense. Sierra says that's right. Got a bunch of people watching. Awesome, awesome. So, those are the two components, and those are the things we need to look for. So what did we do as well as starting her under spinal correction? We've also looked at her immune system, or a window into her immune system, which is the gut, all right? 80% of your immune system is literally in your gut. If you have a gut bacterial overgrowth of something that shouldn't be there or should be in low levels, you have a stool infection. You have a digestive system infection. If that's going on, you are activating your immune system. So we found 2 high levels of 2 different bacteria in her gut. One good thing, again, her healthy lifestyle was leading to fairly high populations of good bacteria. So just taking a probiotic or anything like that, like legitimately, she didn't really need a probiotic. She was taking one before, stopped taking it for a time period. I think we did about 3 weeks prior to the stool sample to see where her gut was on its own. So really she was doing very, very well. And the reality is they show in research studies that your diet, what you eat, can actually change your microflora, your gut bacteria, within a matter of days. A matter of days, you can raise or lower specific types of gut bacteria according to your diet. Really good bacteria, as long as there's a few in there, changing the diet is way more beneficial than taking a probiotic. You cannot feed good bacteria McDonald's and expect them to live. Even good bacteria die on McDonald's. Okay? Thank God some children don't. So, what do we need to do? We need to test. We need to figure out why. We don't need to go back. Remember, the whole point of this is, again, with the substantial significant association between not only autism, now autism is hit and miss. Some research studies say yes, B12 deficiencies in pregnant are associated, and some studies are saying no, vitamin B12 deficiency is not associated with autism. This most recent meta-analysis published in 2017 says yes, it is associated according to the entire body of evidence that they evaluated. I always say that they evaluated, because again, researchers will pick and choose what studies they want to include in their meta-analysis according to qualifying factors of that research. So remember, B12 deficiencies, artificial reproductive technology, when used not under the right circumstances, and that's the truth. Forced fertilization, forced pregnancy is being used. Thank God for all the children that are alive because of it. But the reality is there's a lot of children suffering with significant health or mental health issues because the doctors in those clinics don't do the proper testing to figure out why. I do have a frustration about that. Now, there are a lot of good doctors probably serving and working in there. They've been trained to basically follow a protocol. Literally almost every woman I've ever spoken to that's been dealing with infertility, seen or consulted with a fertility clinic, it's basically the same plan. We'll check your progesterone levels. They won't really check the full hormone gamut. They didn't in this patient. They rarely do. They do incomplete testing, and then they follow protocols until one sticks. The problem is, even if the pregnancy sticks, if the woman's body, her immune system or her nervous system, or she's deficient in nutrients, like in this situation specifically, I'm telling you right now, that is not a good environment for a baby to develop in, to grow in. God could overcome it, but I'm telling you right now, we live in a physical world, and there's a reason a lot of babies are being born to mothers undergoing, couples undergoing in vitro fertilization and other artificial reproductive technologies, and now having to take care of mentally handicapped children. If this test wasn't done, and this wasn't known, think about it again. This mother wants a child. These parents, they want another child. They had one. They want another child. What if they forced the pregnancy? What if in vitro fertilization worked and they forced and elevated the hormones to force the pregnancy to stay there? Mother carries that baby, 36, 37, 38 weeks, goes through a preterm labor. Baby isn't born. It was born early, like so often with with artificial reproductive therapies. Baby's born with less development of the central nervous system, born premature, needs to stay in the NICU, has to suffer, and the mental health consequences to both baby and mom could be huge. Could be detrimental on relationships and future goals and wishes and prayers to be able to go out and do amazing, awesome things with your kids. Create the right environment for the body to accept the pregnancy and allow the mom to be able to carry a child throughout the full term until baby's ready to be born and baby is healthy. That's only going to happen if we help women realize there are reasons why a woman or even a man can be involved in this too, but there's a reason why. Work on the health of those individuals. If we do that across the board, we are going to see the rates of neurodevelopmental problems, spinal cord and central nervous system deficits, brain damage, cognitive inabilities, or adult depression. We're going to see those things go down. We're going to see a lot more people be able to live, the children themselves, without a lot of suffering, with less suffering. And there'll be a lot fewer tears shed by mothers dealing with children and living oftentimes, sadly, with the guilt if they find this information out too late. It's the reality of the world we live in right now, folks. We have to help women. We have to help parents. We have to help people understand what health is, how you achieve it, what is the right doctor to go to, or at least incorporate into your doctors somebody who's willing to ask the questions why and dive in deep, do the proper testing, and walk you through the path to wellness. Show you the wellness way. I'm telling you. Go to thewellnessway.com if you need a doc in your area. If you need support and you don't live near a doc, or you'd like my assistance specifically, you can call my office, 931-591-2010. We can help you directly. All the tests we do, we can get you, all right? We can send you through mail. You can go to any lab test now or other places. You can order the labs. Some other labs, because I was wanting to kind of mention kind of the process we're going to go through is healing, getting rid of these infections in this lady's digestive tract. We're going to be supplementing for a period of time to help boost her levels of B12. And again, we're using proper supplementation, folinic acid, bare minimum supplement with folate. We're using methylated folate. So we're doing the right things, but we're working specifically on the underlying immunological mechanisms by which the things that are causing her autoimmunity, so that we can help her immune system calm down. And by doing so, then she's got that perfect environment for baby to develop well and be healthy when born. All right? Some other tests we'll be planning to do right before we say, okay, thumbs up, or give them the, I wish I knew like the flight, like, it's time to go, you know what I mean? Like, I don't know, Top Gun kind of movement, be like the father, all right, time to go, buddy, yeah. Get your wife pregnant. Well, it's like the timing method. You need to figure out when the ovulation, come on, come on, if you're a guy and you're like doing the timing method and it's like, green light, that means you're ovulating, woohoo, hop on. Yeah, come on. Anthony, my cameraman's back there. He's like, I know it's like, yeah, I like it. So, but I mean, that's the reality. We're going to be doing some additional testing, some things that aren't necessarily diagnostic and figuring out why things are going on, but there are tests you can do to even figure out if you want to just kind of safeguard. Some things that you can do is you can do like red blood cell or serum folate levels. They don't necessarily tell you tissue, but they show you what's in the blood, which can deviate quite significantly. So it's about a 70% efficacy or effectiveness in telling you really truly where you're at in your folate levels and folate storage. It still doesn't tell you whether you may have methylation problems and other issues, but that at least can be checked in situations to say, okay, you do have enough in there, and if your diet's right, you're doing the right things, and you consistently have those levels there, well, those are great tests. Another test to kind of go from both angles is to look at folate levels in the blood and then also do like a homocysteine. And these tests are usually $30-40. All right, we can run isolated ones for that, and that's just kind of a safeguard check that I'm going to do with this patient, so that when we're ready to give the thumbs up for the couple to go ahead and time the, love making appropriately for the conception, you know what? We're good to go. We've taken care. We're seeing the immune system get back on track. We've cleared out some of these. We're going to do retests on her stool. We're going to clear those infections out first. It's another thing that if a pregnancy has already occurred, you don't always want to get too many things out to start killing off those infections. But there's a lot of things you can do also. If there are infections, you can actually work on upper GI health. And if you work on overall GI health, there's other aspects other than just a probiotic, which wouldn't help in this situation because this woman had great good bacteria levels. So they're not just going to crowd things out. That's not always the easy way out. You got to figure out why. And in these situations, a lot of inflammation in the gut. We're going to take care of those things and get her a lot healthier. Do some tests to kind of safeguard and say, yep, levels are good. You know what? We got enough oil in the tank. Engine's not going to blow. All right. You can go ahead. We're going to bring a healthy child into this world through the wellness way. All right, folks. So I'm going to go to Facebook here real quick, answer any questions and comments. If you got them, throw them at me right now. My dad's watching.
Does bigger bacteria have an impact on mental health, like
yes.
and brain fog, or is it more low stomach acids?
So low stomach acids may lead to SIBO, small intestinal bacterial overgrowth. So that's where we use certain herbs to allow for increased gastric juices and acid production. You may want to assist in digestive processes with an acid. You may look at using apple cider vinegar assisted there. You can look at using digestive enzymes. So there's ways to use things that aren't necessarily like you're giving the body what it should be producing. You can do that. Go grab Wellzyme and then the Wellness Way gut one. I forget the title of that one. Go get those. And then, so there's different scenarios, different situations call for different approaches. But in terms of low stomach acid is a major contributing factor to a lot of GI infections and problems. So that's why we approach it from ideally test, and it tells you a lot of what's going on both lower intestinally and upper intestinally. Yeah, those. So Wellness Way supplements for the most part, and actually I think there is a code we need to get from the Wellness Way, because there are some supplements that we do have online, but it's through the Wellness Way, and you have to use the doctor's code. So make sure that we get that doctor's code out there from Bree or Danny. But these are, you can call my office 931-591-2010 if you want these. You just need, for ones that are not offered online through the Wellness Way, you have to have a doctor's consultation to work with you to get some of them. So Wellzyme Complex, in essence, digestive enzymes, Digest Well Complex, which is literally just betaine HCl and apple cider vinegar dried powder. So there's ways, and you can do just, a liquid apple cider vinegar just to start assisting. And there are bitter herbs, eating dandelion. Dandelion's a phenomenal high mineral density, better than kale, spinach, or anything else. It's a superfood. All right, so during times when dandelion is growing, eat them greens. They're phenomenal digestive bitters. And if you look up digestive bitters, one of my favorites is Oregon grape. That's what we carry through the Wellness Way. That's oftentimes our go-to here now with our Wellness Way supplements and herbs. That's a pure herbal extract, organic. I'm telling you, it's one of the best. Again, some of these you need a consultation, 931-591-2010, if you want to get that consultation and get access. Because once you do a consultation and we get an overview of your health, you can then start purchasing herbs that aren't online accessible through our offices. And you can do that through any Wellness Way office locally to you. Or we can ship them to you once we have for the specific herbs there. But anxiety and brain, you look at the research of Lilly doing fecal transplant. So for certain circumstances, it's difficult for a probiotic to get down in the lower GI and stay alive and be viable to actually seed the intestines, the digestive tract, with enough bacteria to grow and repopulate, or there could be massive infections in there that would then kill off the good. So it's like they're in battle against each other, and that's a serious situation. But when you look at different mental health conditions, in circumstances, they are doing what's called a fecal transplant. So literally cleansing out the digestive tract. Typically they do it medically, and then they do a fecal transplant. And through doing so, they've actually seen massive cognitive changes. Neurological improvements, because there is such a strong connection. There's a massive neural circuitry from your digestive tract to your brain, not just the vagus nerve, but the vagus nerve being one of the biggest channels. The majority of the vagus nerve is actually carrying, about 90% they're now saying, of the nerve fibers are transmitting signals back and forth from your brain to your digestive tract. So it's a huge neural circuitry there, and your gut health makes a huge difference in that. He also asks, is there a nutritional panel test to take while pregnant? I typically like to, you can do a lot of things. You can do the general ones, you can do those things, and there's other ones that I recommend. The general ones, you can do nutrients, you could do minerals, you could do, I would suggest a stool sample. I would suggest, if money's not an option, throw in a food allergy, which can change while you're pregnant and can be a little bit more, it could be less and it could be more, depending on your immune system changes while pregnant. A good thing about the body's natural state, and a good thing for many, many children, is that a mother's body actually goes through a process of typically down-regulating the immune system, so suppressing autoimmunity or suppressing. So during pregnancy has actually been a joking, treatment for autoimmune conditions, because some women will go into remission during pregnancy because the immune system naturally lowers in its inflammatory responses to be able to protect baby against brain damage and other problems, or even miscarriage. So that's one thing. So you can do a lot of different panels. Like, a CBC, CMP, you can do serum B12, you could do a homocysteine level, you could do a CRP, you could do tons. But the reality is, I like to say, what are the ones that are probably best fit for this individual that, one, are going to show us what the nutritional status of the patient is, pregnant mother, but also what is some possible underlying factors that are causing the health issues. And if we identify those, then we have tools that don't just tell us where we are. Because a lot of tests, like, again, nutritional status testing, B12 testing, homocysteine testing, kind of gives you an idea of where you're at, but it doesn't tell you why you're there. So when you balance out proper testing, you do some to show you where you're at, and you do some to show you what you need to do to get health. You need to figure out the why. So can you put probiotic in enema solution? Yes, you can. Glad you brought that up, because you can. That's awesome. And that's, yes. Honestly, if you want to know one of the best ways, you take a family member specifically is what I would suggest. You need to know and do testing on the family member. There are ways to do it without having to pay, I forget, several thousands, tens of thousands of dollars for these tests, or the fecal transplants sometimes. But there's actually, you could do and use the baby poop from a breastfed baby. I know that people are probably really grossed out that I'm even admitting this and telling people this, and then the doctors are going to be like, that's so dangerous, what, the baby has infection? Yeah, I understand. But the reality is, do the testing appropriately on the individual, know that they are healthy, know that the mom is healthy, the mom is feeding baby correctly, and the stool and everything is healthy in the baby. And if you do that, you know that, well, then you could do that. And again, you could use a probiotic, but it's going to be much more minimal compared to natural and that. So there's like what you could do on the extreme of the natural, and then there's the just simply doing an enema with a probiotic. And again, sometimes you want to cleanse the environment, so you may want to use prior to in circumstances, and this is what I oftentimes suggest, is that we cleanse things out. If we're going that route of like enemas, you actually want to go through a cleanse process, remove things, try and get rid of it and kill off those bacterial infections. And there are different herbs that are actually really, really good for this, because there's a lot of bacteria that are antibiotic resistant. All right, and they survive really, really well. So there are a lot of herbs, though, are able to kill off bacterial strains that antibiotics and drugs cannot. All right, and they're actually blanketing many different bacteria, so it's really, really awesome what herbs can do. And you use a combination of herbs, cleanse things out, get the good in, and then sometimes you can replace the bad with the good and allow the person to heal. I think Ashley actually brought us something that I wanted to make sure that everybody's aware of coming up here in a couple weeks. If you're not, this will be in person alone only. It will not be. So it's our hormone talk. So the hormone connection, this will be Dr. Patrick Flynn will be putting on this presentation here. He is the hormone whisperer. He'll be coming to town, and the date on there is what again? See, I don't even remember dates.
19th.
October 19th, folks. So October 19th, good buddy of mine, Patrick Flynn, the hormone whisperer, the head honcho of the Wellness Way, will be joining us in Clarksville, Tennessee. And this talk will be in person alone. You have to get tickets for this event. Share this information, make sure people know about it, get information off of the Facebook site, and I'm sure they can find links pretty darn easy there, and you probably will tab. It's pinned to the top of your Facebook right now, Ashley said.
Your Facebook.
My Facebook,
The Wild
not their Facebook,
Correct.
the Wild Doc Facebook page, right? Not this talk.
Right.
So if you do that, please, love to see you, but you have to be local. It will not be online. This is a talk that Patrick Flynn travels literally the world to do. So it is his, I don't want to say it's his family jewels, but it's, one of them jewels he has. He's a wealth of knowledge. Look forward to having him in town. So if you guys want to join us locally in Clarksville, Tennessee, please do so. All right, everybody. Again, I think we can wrap this up. So appreciate all the questions there, Alma and Kitty and others that have tuned in. Again, everybody, I'm the Wild Doc, Dr. Dale Brown, out of Clarksville, Tennessee. If you need my help, give me a call, 931-591-2010. And again, I ask everybody out there, please share this information, because if we don't share, if we just like things, all right, we're not saving lives. So share the truth, don't just like it. It's the only way we save lives. Peace out, everybody.